Why are vegetables considered natural medicine for the elderly? Why tomatoes, cucumbers, and garlic? 1. As a person ages, a number of natural changes occur in the body. Muscle mass decreases, bones become brittle, immunity weakens, and the digestive system slows down. Although all of these processes are part of natural aging, they can be slowed down and alleviated. The most important way to do this is to eat right. Vegetables are not only a source of vitamins and minerals. They contain antioxidants, protect young cells from the harmful effects of oxidation. Fiber improves bowel function. Phytochemicals reduce the risk of cancer, heart attack. Water prevents dehydration in the body. Tomatoes, cucumbers, and garlic are especially beneficial for the elderly. The combination of these three vegetables can provide a healthy heart, strong immunity, and good digestion. Tomatoes are a powerful source of an antioxidant called lycopene. Studies show that lycopene reduces the risk of heart attack and protects against prostate and some other types of cancer. Tomatoes also contain vitamin C and K, potassium, and folate. Cucumbers provide the body with water and potassium, which helps maintain normal blood pressure. Fiber normalizes bowel function, which helps solve the problem of constipation, which is common in the elderly. Garlic has been used since ancient times as a natural antibiotic. It contains a substance called allicin, which fights bacteria and viruses, slows blood clotting, and reduces the risk of heart disease and stroke. The following conditions are more common in older people: increased blood pressure from salty, fatty, and high-calorie foods. Slowing blood circulation increases the risk of stroke and heart attack. Slowing digestion, often with constipation or stomach upset. Reduced immunity. The risk of colds, flu, and other infections increases. Tomatoes, cucumbers, and garlic can alleviate each of these problems to some extent. Tomatoes protect blood vessels, strengthen the heart. Cucumbers hydrate the body and improve the digestive system. Garlic strengthens immunity, lowers blood pressure. In what form is it most useful to eat? For the elderly, the ease of digestion of food is very important. It is recommended to eat tomatoes, cucumbers, and garlic in the following forms. Ripe tomatoes. Lycopene is better absorbed during cooking. Therefore, it is useful to eat tomatoes not fried, but steamed or baked. Fresh cucumbers, in salads or in juices. If the peel is soft, you can eat it without peeling it. Garlic has the strongest effect when freshly crushed, but if you have a sensitive stomach, it is best eaten cooked or dried. Cooking tips for the elderly. Use less fat, especially animal fat. Add salt to a minimum. Use lemon juice or spices instead. Prefer steaming, boiling, or baking instead of frying. Try not to make food too spicy, so as not to upset the stomach. Try to eat vegetables in season. Their beneficial substances decrease during the off-season. Tomato, the red friend of the heart, more too. The tomato has long played an important role in human nutrition, but it took several centuries for it to become so popular. Its homeland is South America, in particular, the territories of modern Peru, Ecuador, and Bolivia. The Incas and Aztecs cultivated tomatoes as early as BC and used them in spicy dishes. At the end of the 15th century, tomato seeds were brought to Europe by Christopher Columbus and other sailors. At first, the tomato was considered a fruit of death because it belonged to a family of some poisonous plants. Only by the 17th century did chefs in Italy and Spain begin to use it in cooking. Then it became known all over the world as a favorite vegetable, botanically a fruit. Tomatoes are not only delicious, but also provide the body with a lot of useful substances. 100 grams of fresh tomatoes contain water, 94%, reduces the risk of dehydration in the elderly. Energy, 18 to 20 kcal, light and suitable for diet. Carbohydrates, 3.9 grams, main source of energy. Protein, 0.9 g, necessary for cell renewal. Fat, 0.2 g, minimal, does not burden the heart. Fiber, 1.2 g, improves bowel function. Vitamin C, 14 to 17 milligrams, strengthens immunity, rejuvenates skin. Vitamin K1, 7.9 ug, important for blood clotting and bone health. Folate, B9, 15 ug, supports new cell formation. Potassium, 237 milligrams, regulates blood pressure. Lycopene, 3.7 milligrams, powerful antioxidant, protects against cancer and heart disease. Makes. Main benefits of tomatoes for the elderly. Strengthening heart and vascular health. A study published in the journal Atherosclerosis in 2017 followed 5,000 elderly people for 12 years. As a result, it was found that those who regularly consumed lycopene had a 26% lower risk of heart attack. Lycopene reduces inflammation in the vascular wall, slows down the oxidation of cholesterol, and improves blood circulation. 2. Maintaining vision. An article in the journal Investigative Ophthalmology and EMP. Visual Science proved that lutein and zeaxanthin protect the retina from harmful ultraviolet rays. These substances reduce the risk of cataracts and macular degeneration, especially in people over 60. 3. Reduces cancer risks. A 6-year study of 47,000 men from Harvard University found that those who ate more than 10 tomatoes per week had a 35% lower risk of prostate cancer. Lycopene protects DNA from oxidative damage. 4. Boosts immunity. Vitamin C plays an important role in the body's phagocytic cells, which play a role in eliminating infections. Nutrients, 2017. Vitamin C and phytochemicals have anti-inflammatory effects. 4 things to be careful about tomatoes. Acidity. According to the journal Gastroenterology, tomato juice can aggravate reflux disease. Kidney stone risk. Oxalates combine with calcium to increase the likelihood of stone formation. Journal of Urology. Allergy. In very rare cases, lycopene allergies have been reported, which cause redness on the skin. Unripe tomatoes contain solanine, which can cause stomach upset. Food chemistry. Recommendations for eating tomatoes for the elderly. Lycopene is absorbed 2 to 3 times more in heat, so it is beneficial to steam or bake rather than fry. Olive oil increases the absorption of lycopene. Salt-free consumption is especially important for people with heart and kidney disease. Cucumber, body. Cooler and colon cleanser. Cucumber, Cucumis sativus, belongs to the gourd family and has been cultivated by humans for 3,000 years. According to historical sources, cucumbers are native to India, where the hot climate was very favorable for their growth. In the pre-Christian era, cucumbers were used not only as food, but also as a means of protecting against heat and moisturizing the skin. Biochemical composition of cucumber per 100 grams of fresh cucumber. Water, 95–96%, very important for preventing dehydration in the elderly. Energy, 15 kcal, suitable for, necessary for muscle and nerve function. Potassium, 147 milligrams, regulates blood pressure. Antioxidants, beta-carotene, flavonoids, lignan. 4 benefits of cucumbers for seniors. Prevent dehydration. A study in the Journal of Aging Research, 2019, found that dehydration in older adults can reduce cognitive function. Cucumbers are 95% water, which effectively hydrates the body. 2 lower blood pressure diets high in potassium have been shown to reduce the risk of heart attack by 27%. American Journal of Clinical Nutrition, 2017. Potassium helps to lower blood pressure by removing sodium, salt, from the body. 3 improves bowel function. The combined effect of fiber and water activates beneficial bacteria in the gut. Nutrients, 2020. The insoluble fiber in cucumbers cleanses the intestinal wall and prevents constipation. 4 anti-inflammatory flavonoid and lignin antioxidants reduce inflammatory markers in the body. Phytotherapy Research, 2018. Joint pain and arthritis symptoms are relieved. 4 things to be careful of with cucumbers. Stomach upset. Eating too many cucumbers can slow down digestion in some people. Allergic reaction. In very rare cases, a bitter taste or swelling in the mouth may occur. Allergy, 2016. Kidney problems. Too much potassium can be harmful to those with kidney failure. Nitrates. Cucumbers can be high in nitrates if they are not properly grown. Food Control, 2014. Cucumber consumption recommendations for the elderly. Eat cucumbers that are organic or from a reliable source. Choose freshly picked cucumbers, as the vitamin C content of cucumbers stored for a long time decreases. Don't eat pickles too often. The high sodium content can increase blood pressure. Was this video useful to you? Then don't forget to share it with your loved ones. Subscribe to our channel and receive the most useful tips for you every day.